going to be sharing my experience for a day in the life as an acute care physical therapist. Right now, I'm a PT student at Upstate Medical University in Syracuse, New York. So first, I just want to run you through what a typical day would look like in my setting. The first thing I do is I grab my vocera, which is used to communicate with other healthcare professionals throughout the hospital. This is very important in acute care because patient care is very collaborative. Next, I will take a look at my schedule for the day. Something about acute care is you don't have a specific time to see patients, you just have a specific list of patients to see, and then we are able to prioritize our schedules based off of many factors such as frequency. So if a patient is supposed to be observational status or pending status, I will see them first rather than twice a day or 5 times a week. I will also take a look at when patients have procedures or surgeries or really anything that will take them out of the room to make sure I don't try to see them at the time that they are unavailable. I then go into a chart review. The first thing I look at is lab values and vital signs. Those can be really important determinants of if the patient is even appropriate for physical therapy. I also take a look at documentation notes, whether it's from physicians, nurses, PTs, OTs, case management, really anybody that can give me a better understanding of these patients as a whole. I also take a look at precautions, whether they are post-surgical or infectious disease precautions, really anything that I need to be extra aware of before entering these patient rooms. I typically then give the nurse a call to make sure that they agree the patient is appropriate and available for physical therapy. I then begin my treatment session. So upon entering a patient's room, the first thing that I look at is lines and tubes. The thing about acute care is some patients have none or very few, and some have a lot. And that can be a really determining factor of what your treatment session is going to look like to make sure that these patients can stay safe throughout the session. I then begin with patient education. In acute care, education is very important because patients don't tend to understand the benefits of physical therapy, the goals of physical therapy, and they will refuse you before even understanding why you're there. So education is very important because patients will tend to be more agreeable to work with you once they do understand why you're there. Then I will go into interventions. So for interventions, some things that you can do are therapeutic exercises, ambulations, stairs, really anything that relates to patients' current level of function, prior level of function, and helps aid in discharge planning. So for example, if a patient has to navigate stairs at home, I will work with them on stairs in the hospital to make sure that they are able to get home and get home safely. After my treatment session is over, I will go into documentation. So sometimes I will document multiple patients at once and sometimes one at a time. It really depends on patient complexity. I will now talk a little bit about patient populations that I see. So in acute care, something that's very unique is you are able to see a wide variety of patient populations. I have been on the ICU, neuro ICU, trauma, orthopedics, general medicine, the burn unit, emergency department, pediatrics, really anything that you can think of. Going along with uniqueness in the acute care setting, I think something that's unique is the collaboration between healthcare professionals, because everybody has the same goal to get these patients home healthy and safe, and we are able to work closely with other providers to do that. Now just some advice before coming into the acute care setting, because it can be very nerve-wracking. I would say something to know is change in status. So in acute care, patients can be walking around one day and then you go to see them and they are unable to stand by themselves. You have to be able to think quick on your feet and make fast but safe decisions. So for me, I will go into a patient room with an idea in my head and a plan of what I would like to do, but typically that has to change once you get there. So being able to think quick on your feet and make decisions and come up with activities is something that can be very challenging, but is also very exciting and rewarding because you are able to understand that you are helping these patients in this new moment that they are experiencing. Something else to just know before coming in, I would say that the goals of acute care physical therapy in general is early mobilization, focusing on functional tasks, strengthening patients to make sure that they don't get deconditioned while being in the hospital, because that can be very common, and we want to keep these patients strong in the hospital so that they are able to get home rather than have to go to rehab. I really hope that this was helpful, and good luck to everybody going out on clinic. Thank you.